Hello, this is Dr. Azy, and we are going to continue in our MRCS Part B stations, and we are going to discuss procedural stations. And in procedural stations today, we are going to discuss the most common procedural station ever. Okay, most of the people who has taken the exam, including me, has passed through this station. It is simple surgical suture. Okay, and although every one of you knows how to make a simple surgical suture, but it is not about that. Okay, if you see the station or the questions of the station or the steps that you have to do, there are many steps, maybe 10 steps or more. Okay, every step has about 2 marks. Okay, so the surgical knot or the surgical suturing itself is one of these steps which has only 2 marks. So if this is a station for the simple surgical suturing of a clean surgical wound, you are going to make a simple surgical knot. And if this knot takes only 2 marks, what are the other questions that you have to answer, or the things that you have to do to get the full 20 marks? This is the question. Actually, this station is not a station about surgical suturing. It's about professionalism. Professionalism. Okay? And we are going to go through it step by step. Okay? So, for this simple surgical sutural station, simple suture, okay, there are many steps that you have to know, and in every step I have to tell you why many people fail this very easy station. Okay, because there is an order for many things that you have to know, and if you do not know them well, you will lose the station, although it is a very easy station. It's a full mark station actually. So you are going to start, you are outside, you hear the bell there that you have to enter inside the room of the station, and you entered inside. First thing you are going to do, number one, you are going to wash your hands. Okay? First thing. The second thing that you are going to do is that you are going, these are 2 marks, okay? You are going to introduce yourself to the patient. Okay? These are 2 marks. You see, it is so easy, but many people miss these. Okay? In this way, you are a professional. The third point, or the third thing that you are going to do, and it is very important, I think that it has more marks, is taking permission from the patient and explaining the procedure. And this is crucial because it is ethical. And ethical things or ethical points in the MRCS Part B take the greatest marks. This is very important. Okay. So after you have taken the permission, you are going to tell that I'm Dr. So, you wash your hands, I'm Dr. So-and-so, and I'm one of the candidates of the exam, and I'm going to suture your wound. Okay, I'm going to anesthetize you, and I'm going to suture your wound. And do you have any problem with that, or do you allow me to do that? If he said yes, then you have to proceed. Okay. The fourth point, and it's a very important point, is that you are going to ask about allergies. And I will write all the fatal points by this. Allergies, okay? This is fatal. If you miss this, you will lose the station, even if you did well in other things. So this patient is going to take anesthesia. You are going to ask specifically that, did you have any allergy against any anesthesia or local anesthesia before? Okay, if he said no, then you can proceed. Okay, well, then what is the fifth step here? The fifth step simply is that you are going, so this, I'm going to make a star here. This is very important. So the fifth point is that you are going to prepare your equipment or your things that you are going to use in your suturing. If you are lucky, and you will be, the examiner is going to tell you that this is your assistant. Somebody will be there and he will be your assistant. This is your assistant, and you can ask him whatever you want. This patient is well prepared, he is anesthetized, and the wound is cleaned. He is going to tell you like that because of the short time of the station. Okay, so in this case, you are going to find the patient with most probably a thigh wound. It is not a true thigh wound, but it is a true patient. It is a true person, I mean. Okay, he is a simulator, and he is there, and he is going. They are going to fix some sort of foamy maquette that includes a clean wound, just cut very nicely. Okay, and it is tightly adhered to the thigh of that lady or that gentleman. Okay, they are going to tell you that everything is prepared. You are well disinfected. You washed your hands. Everything. Take your gloves and start suturing. If you are lucky. If they ask you, they didn't mention that you have now to prepare your things. You are going to ask your assistant to help you, and the first thing you are going to think about: this wound is clean. It is washed, so now you are going to anesthetize the patient. If they ask you to do this step, there are two fatal things that you have to know. Okay, so in anesthesia, there are 2 points. The first point is that if they ask you to anesthetize the patient, or they did not tell you that this patient is anesthetized, and this is not common actually, first of all, they want you to, first of all, read the expiry date of the local anesthetic, which most probably will be lidocaine with adrenaline. Okay, so this is a fatal point. If you miss this, this is dangerous. Okay, so you asked about allergies here. Okay, and now you want to read the expiry date, and after you read it, you are going to mention this by your voice. This local anesthesia will be expired on so and so to 2025, for example. So it is now not expired. That's fine. Or if it is a previous date, they are going to tell you that this is not expired. Go on. The examiner will tell like that. So this is the first point. You are going to withdraw from the anesthetic bottle. All of you know that, with one needle, and you are going to change the needle when you are going to inject in that maquette, that foamy thing which is adhered to the thigh of the lady or the man. Okay, so when you are doing, after you do that, the other fatal point is that the sharps pin. This is a very dangerous point, very dangerous point. You want to know that you have to expose your things carefully. So the sharp pin there, you're going carefully to expose your sharp needle and syringe. Okay, so these are the fatal points here. Well, anesthesia finished. Now you are going to make the suture. So now, and this is the easiest point, which you all know, is the suturing process. You are going to use, this is an outside or a skin wound in the limbs. You are going to use a non-absorbable monofilament suture. Okay, suture material. So it will be a proline or nylon. It will be about maybe 40, something like that. We are going to discuss this later here in this station. So you are going to do your suture. It will be a very simple thing, simple surgical suture. You are going to make your knots. You are going to take your bite about 0.5 centimeter from the edge of the wound, that beautiful nice wound that is made for you, and you are going to make a space of about 1 centimeter between each knot. Okay, fine. So you are going to start from one edge, and you are going to go to the middle, and then you can, if it is well approximated, you are going to continue. If not, you are going to start from the other side. So this is not a problem. They will not even look at you when you are doing suturing, because they know that you are going to do suturing thousands of times in your life. So this is not a problem. You finish your suturing. We are going to the 8th point here, and the 8th point is the disposal of sharps. Again, you are going to dispose the needle safely, and this is a fatal point also. Okay, so they will not focus on your suturing, but they will focus on this, believe me. Okay, so you dispose safely. While you are doing suturing, you are going to give some advices for the patient before it ends, and this will look professional. So when you say the things from yourself, that will be better for you. Okay, you are going to look more professional. Okay, so first of all, the first thing that you are going to ask about while you are suturing is that, did you get your tetanus vaccine? Do you have a full course vaccination for tetanus? So the ninth point will be tetanus vaccine. Okay, so this point, actually, in this point, the examiner is going to ask you strictly. So you are going to ask questions to the patient while you are suturing or after you finish, and you are going to ask him or ask her that we are going to make a table here for you, and this table will help you to deal with the situation well. Okay, well, so this is the status, vaccination status. Okay, and this is a case with, I will change the color here, with full course with booster. So you know that tetanus has full course and has a booster, with booster dose in less than 10 years. Okay, the other one is a full course with booster in more than 10 years. And the last one, either unknown, not known if he is vaccinated or she is vaccinated against tetanus, or not vaccinated. Okay, so you have two types of patients. Your patient's case is a low risk, because this is a simple surgical wound. So he or she is in low risk of tetanus infection, and there is high risk also. They are going to ask you about that, but it is not your case here in this simple suturing for a simple surgical wound. Okay, well, so in tetanus vaccination, you want to know that if the patient had his full course of vaccination with a booster in less than 10 years, there will be nothing to be done here, nothing to be given. Okay, if the patient is a high-risk patient with an dirty wound, for example, that you needed to clean, this is not common, but if it is dirty and you want to clean it and make it a surgical wound, because this disturbed wound is not a surgical one, you want to make it a surgical one, like the one which will be given most commonly in your station. So in this, if high risk and he is or she is fully vaccinated with booster in less than 10 years, you are going to give single immunoglobulin. And just to be honest here, you are going to give simple immunoglobulin for everyone in this category of high risk. Simple immunoglobulin for everyone. Either this less than 10 years, more than 10 years, or not known. Okay. Well, let us go to the next one. If the patient has full course of vaccination but had the the booster in more than 10 years, the situation will change. So what you will add in both categories here is the booster toxoid. Okay, booster toxoid and the booster toxoid here also. Okay, for the high risk, in addition to the simple to the single immunoglobulin booster toxoid. Okay, for the unknown or not taken, okay, you are going to give the full course of toxoid. And here also for the high risk, in addition to the single immunoglobulin dose, you are going to give a full course of toxoid. You see, it is so simple here. So for here, these people all high risk take single immunoglobulin. Then the additional thing will differ according to if it is more than 10 years or if it is not known. If more than 10 years, by hook or crook, low risk or high risk will take booster toxoid, and if it is not at all or not known, is going to take the full course of toxoid whatsoever. But in high risk patients, this single immunoglobulin is always taken. Okay, so this point here you have to know well. Okay, if you did not ask, the examiner is going to ask you after finishing suturing, what are you going to do now? You are going to say that I'm going to ask about tetanus vaccination situation. Okay, well, what else? As you are finishing your suturing, now the final step is that you are going to give professional advice. What is the professional advice? It is 2 points. The first point is that you are going to mention for the patient what to do after this. You are going to tell him that, please, most probably this is in the limbs, but we are going to mention all the body parts which are maybe included in some wound. Okay, so the facial, and this is not common in the exam of if the wound is in the face, you are going to use a suture size of 50 or 60, and you are going to remove it within 3 to 5 days. So in this station here, this is not your case. Okay, if it is in the scalp, okay, you are going to use, because scalp is thick, so you are going to use 3 or 4 the size of the suture material, and you are going to remove this from the scalp within 5 to 7 days. If it is on the limbs, you are going to use size 4 of this non-absorbable monofilament material, and you are going to remove it in 7 to 10 days. So this is your case. You are going to tell the patient, please come to our clinic or come to the hospital or to the health center or whatsoever within 7 to 10 days, so that we can remove the sutures. This is your advice, first point. Okay, so this is the first point here that you want to know or you want to tell to the patient. So let us finish this. If the wound is in the back, if it is in the back, you are going to use 30 or 40, and you are going to remove the sutures within 10 to 14 days, and most probably this is not your case either. Okay, so first advice, this professional, please come to our clinic within 7 to 10 days that we can remove the suture. What is the second advice? The other advice. The other advice is that, sorry, I will change the color here also. Okay, the second advice, that you are going to tell him that please get back to the A&E department if you had anything abnormal. For example, if the patient developed pain at the wound site, if the patient developed increased pain, there will be pain, but increased pain, more pain. It should improve after the suturing and everything gets better with healing. Okay, if the patient got redness, if he noticed some, these actually are signs of inflammation and infection. If the patient noticed some sort of discharge or blood from coming, bloody discharge or yellowish discharge on the dressing, if there is a malodor means that there is an infection, okay, and if there are any systemic symptoms like fever, let's say for example nausea, malaise, like these systemic symptoms, please, if you feel any of these, please get back to the A&E, please, or come to our clinic, just get back, okay. So these are the points that you are going to give as a piece of advice to the patient while you are finishing the suturing or after you finish. So these points, 2 points, both of them are fatal. You cannot miss these, okay, fine. So finally, they may ask you some questions. They may ask you about the dose. Here, this is another point about this anesthesia. It is not a fatal point, but you have to know it. So what is the normal dose of lidocaine? Okay, you are going to tell that it is 3 milligram per kg for the adult. So lidocaine plus adrenaline, okay, it is 7 milligram per kg. Actually, okay. So this, in case that they advise you to give the anesthesia and not the patient is not ready for you, okay. What else they may ask you here? Yes, actually what will be asked to you here, I will add it somewhere here, okay. This, the 11th point here is, what about the treatment, medications? And the medications in your case will be only analgesia, okay? I will give analgesia unless there are complications. And if they may ask you if the wound is not like this, if it is dirty, if it is contaminated, what are you going to do? So in simple inflammation, or if the presentation is late, you are going to give 1 dose of antibiotic, okay? If it is more complicated, you may give 1 dose on presentation, and then after that you may give other 2 doses, okay. So this is not a common question in this station, but you want to know it in case that they asked you, you want to know. So this is everything about this station. There are many fatal points. You want to ask about allergies. First of all, you want to wash your hands and introduce yourself and take permission. These are very important. You are going to ask about allergies. You are going to check the expiry date of the anesthetic. You are going to use the sharp pin whenever you need it, okay. And here again, this sharp pin, it is very important, okay. And you want to know the information about tetanus vaccination, okay, of any patient with any wound, whatever it is, simple, okay. And you are going to give these 2 advices, and you are going to discuss medications as analgesia and antibiotics, okay. So thank you very much, and I will see you in the next station.